How do you fix a heart rhythm that's out of whack? Atrial fibrillation, or AFib, affects some 3 million Americans. And as you can see in this animation I'm pulling up on the iPad, let's take a look. The upper chambers of the heart beat erratically, and blood just isn't pumped through the body in an efficient way. Now, doctors at Virginia Hospital Center are using a team approach to tackle AFib that doesn't respond to standard therapy. 2 heart specialists, 2 different procedures, and one goal, getting rid of atrial fibrillation like Jim Poplawski had. The 54-year-old had tried medication, attempts to shock his heart back into sync, and several ablations, in which radio frequency energy is channeled through a catheter to create scar tissue that disrupts the abnormal rhythms. None of it worked for Jim.
We went through quite a bit.
Finally, a new approach called Convergent Maze Procedure became available at Virginia Hospital Center. Part 1 begins in the operating room with cardiovascular surgeon Dr. John Garrett.
A less than an inch incision just below the breastbone here. And then I go into the abdomen and put some instrumentation with a camera in, and then I open the heart sac.
Dr. Garrett uses this cannula equipped with a mini suction device to treat the back of the heart, an area that's tough to reach.
It sucks up to the back of the heart, and then I deliver radio frequency burns, which causes scar, which ablates the abnormal rhythm.
Once he eliminates these abnormal circuits in the back of the heart, the patient is then moved over to the electrophysiology lab.
And you take over.
And I take over.
Dr. Rashid looks at what he calls a voltage map before performing more ablations on any remaining trouble spots.
And once we do that, most of our patients trip back into normal rhythm.
It takes about an hour and a half. They go home after 1 day in surgery.
They put you out, and I woke up later that day. Really no pain at all.
Virginia Hospital Center is the first in Northern Virginia to offer the Convergent Maze Procedure. As for Jim, he's been able to get off almost all the medication he used to take except for a blood thinner, and his heart is doing great. Leslie?
What a great story.